In Asia, it was Singapore that had the first confirmed local transmission of the Zika virus back in August. It was not an infection carried in by someone from outside, but a locally incubated contagion from a local mosquito. Here, as elsewhere, the female Aedes Aegpti mosquito is the culprit. This small city-state with an advanced medical infrastructure detects diseases and epidemics early, unlike for many other nations in the region. And Singapore has the resources to cope. On August the 31st, Singapore became the 58th country to declare an active Zika hotspot, according to a survey by America's Center for Disease Control and Prevention. But the World Health Organization fears that the risks of propagation have been underestimated in other Southeast Asian nations, where diagnosis is far less developed. On the list of countries where transmission risks are thought to be local and endemic are Thailand, Indonesia, Vietnam, and the Philippines. The epidemic of the Asian strain of the Zika virus was first discovered in Latin America in 2015. In the entire Americas, only Chile, Uruguay, and Canada have been spared. In Africa, only Cape Verde has been affected for the moment. But in the Pacific region, the CDC has identified active local hotspots in 8 countries. In February 2016, the World Health Organization declared that the Zika virus was spreading fast and that it was an international public health emergency.
Though we know much more about Zika after the first 7 months, there's still an urgent need to continue sustained and global research, and this still does remain an emergency of international concern. Zika is beginning to spread, or continuing to cause outbreaks in many countries around the world.
Yesterday, the WHO revised upwards the period of risk of sexual transmission to 6 months from just 8 weeks, during which time abstinence or prophylactic use should be followed, even if there are no symptoms. This is because the consequences are so serious for unborn children. Serious anomalies in brain development, including microcephaly and deafness, can result.